Good afternoon. I'm Dave Carlson from Clinical Cloud Solutions. I'd like to be described as a mobile app for care planning. This app was conceived and designed from the beginning based on FHIR standards. All the data within the app is natively stored as FHIR standards, FHIR resources. And so I've got to cover in 15 minutes, so let's jump in. So there are 5 components or features within this application. Each of these components is accessed through a tab on the app. You see across the bottom the 5 tabs in there. And I'll be stepping through each of these 5 through slides, and I've got a 3-minute demo video of the app in operation at the end. So we move pretty quickly to cover these topics. I want to point out here a couple of, I think, unique features right now. One I call the guide. So I've integrated CDS hooks. I've written a Swift library for iOS, and so it invokes CDS hooks as a client. And I've got some examples in the demo to show you that. But I think it's the first example I've seen where CDS hooks has been used from a patient-facing app and also within a mobile app. Another aspect, which the tab titled today, I've got integration of the FHIR data from the care plan with Apple's CareKit and HealthKit frameworks. Again, I'll be describing that, showing that in the demonstration. So let's jump in. First, I want to introduce Meghan. So Meghan is a post 9/11 female veteran. She is one of 4 personas being developed by the Veteran Health Administration team called the Human Factors Engineering. They're creating 4 personas that are based upon several years of interviews with veterans, clinicians that care for them. They're very thorough, and their methodology is really excellent. I could spend half an hour talking about their work here, but I refer you to the website that's linked here. It's a wealth of information for understanding requirements and testing. So the description of Meghan, although she has a long list of health conditions, this is very realistic. This is based upon specific interviews with veteran persona. So in her case, with traumatic brain injury, PTSD, depression, and she also recently became pregnant. So the journey that they describe here goes into her care coordination between the VA and an outside provider. Again, a lot to talk about here, but I'll just cover this quickly through the whole life cycle of the app. This is another PDF that they provide. If you go to that website, you can download this plus similar output from 3 other personas. So the first overview, this is a Smart on FHIR app. It uses OAuth 2. It's a standalone app from the OAuth 2 launch framework. It's built upon a library, an open source library, Swift Smart. So it provides the OAuth 2, the launch support. It has complete support for the FHIR version 3. In addition to that, I'm creating other iOS frameworks written in Swift, which I intend to release as open source. Invite any of you interested in this right now. Still in the process of developing and refactoring those. So the library for CDS hooks client. Also view controllers for care plan, for the FHIR care plan, and then also the mapping between FHIR and the Apple CareKit representations. So when Meghan goes, I'll describe this from Meghan's point of view. Meghan using this application. So when Meghan connects to her EHR system or treats her care plans, she can look then at the care plans tab. She has 2 care plans. One is her primary care plan from her VA care that provides support for her list of chronic conditions. Also a new care plan for prenatal care, which is created and managed by her provider for her OBGYN support. There's also a list of her full conditions and health concerns listed here. When she clicks on one of the care plans, prenatal care in this case, this is using the FHIR care plan resource. That allows you to define which health conditions are addressed by this care plan. Also references to which goals are supported by this care plan. And then also, most importantly for this demonstration, are the plan activities. And for the plan activities, they may include medications, procedures, or tasks to be performed by either her care team or by Meghan. And also assessments that may be performed. I'm especially focusing on activities that are assigned to the patient. That's allowed by this FHIR representation and very important from a person or patient-centered application. So in this case, we'll be looking especially at activities assigned to Meghan. Also FHIR, some of you are familiar, just to show you an example of, I've created sample data for this, which are all available on a GitHub site for Meghan. So any of you interested in and really understanding the care plan resource is the representation of data that is being accessed and used by this app. So when Meghan clicks on the Today tab, this is where it takes all of the planned activities from the care plan resource and maps them into the Apple CareKit framework, which has its own data structures, displays them in a view which is provided by Apple's open source CareKit. In this case, Meghan is able to review assessments that were on her care plan she's asked to perform. She can provide a ranking for what VA calls a distress level for PTSD. So she can assign a ranking on that on a scale of 1 to 10. She can also, in her care plan, provides the activities for her by her care team, requesting her to perform their patient outcomes on her progress or lack of progress in her care plan, or specific assessments that they want her to collect. In the case of some of these that map to Apple's CareKit, Meghan is required to or asked to offer permission to the app. So the CDS hooks. CDS hooks provides a black box to the CDS service. It provides a service interface to invoke a CDS service. It doesn't really know or care what the representation of the decision support logic is. It's really one of the advantages of CDS. So I've written a Swift client that allows this mobile app to call any CDS hook services. So there's some details here on the envision I have for this is that in care planning, whether it's Meghan using this app, or as I'll describe toward the end, really the same app for the most part being used by her care team members. So her care team members sharing care teams among other members of the team, especially when there's coordination of care across providers. And the ability to invoke CDS that evaluates progress or laggard progress toward goals within that plan, or to provide a recommendation. So in the CDS hooks, there's something called a suggestion card, which can embed within it a resource that the CDS recommends, which examples they use typically are for medications, but in this case I'm working on some prototypes that would create suggestions about new activities that would be added or should be added to the care plan. If those are accepted, they'd be added to the care plan and would appear within the plan for the care team to use. So some examples of where we're working on this. Let's take a look at how this appears. So there's a My Guide tab. This tab invokes the CDS hooks. So for this demonstration, I've got two different completely independent CDS services using the patient view hook. And the first one is one I'm prototyping based upon FHIR standards for plan definition and the clinical quality language. I've got a link here to an open source server called the Clinical Quality Framework, or CQF Ruler, which implements support for this. So I've written a fairly simple, but it illustrates the use of these standards to define a service that pulls from Meghan's record, her observations for weight and height. If they are not available, it actually would return an info card asking her to provide those values. It computes the BMI using the CQL language. If her BMI exceeds the guidelines for being overweight, it returns the card shown here, which is a weight management, a brief note about her BMI indicates she's overweight, and a link for further information. The second card here, just to show how this would be integrated, there is a CDS hook service being developed for the Australian guidelines for preventive care. I have no idea how they've implemented, but they offer an open CDS hook service. So I've integrated this app. It passes data to that service from Meghan. It passes her problem list, the patient as a resource, and some of her most recent observations. From that, it may or may not return cards for preventive care recommendations. In this case, it notices that she's pregnant. It does not have a record of her smoking status, so it provides a card in return that you may want to ask about her smoking status. So Meghan's care team. So the care team resources are also from the FHIR standard. It retrieves her care team and the members of perhaps multiple care teams from her care plan resources, maps that data into the Apple CareKit. So the CareKit framework has user interface views, which are shown here. It does not include any internal data structures for care team, but it provides a very nice user interface. So I've mapped the FHIR care team representation to these views, and they're presented here. You'll see this in operation in the demo. So without further ado, this is about a 3-minute demo of me walking through the app.
My care guide is being demonstrated on an iPhone 6. Meghan, our veteran, is reviewing her records from the VA plus her community provider for her new pregnancy. She reviews her current medications, allergies, and some prior assessments. She's able to review her guide, where she currently has one warning about smoking given her new pregnancy. She has stopped smoking and needs to have this updated in her record, at which time this warning will go away. She reviews her care plans. She currently has 2, a primary care plan from the VA and a prenatal care plan from her new OBGYN. She can review her complete list of conditions and health concerns, plus goals that have been defined for health care. She looks at the detail of a care plan, primary care in this case. She can review the health concerns that are specifically addressed by this plan, the goals for this plan, and activities. So the activities include medications, tasks, and procedures, as well as assessments that she can perform. After Meghan reviews her assessments and plan activities, she can then look at the tab Today, which lists the activities and procedures that she should perform on the current day. There are a number of activities for back pain, distress levels she can perform based upon her anxiety and stress from PTSD, as well as a number of medications. She can indicate that she has taken acetaminophen for her back pain. She's taken her folic acid and her vitamin D for her pregnancy. And she wants to indicate that her distress level is currently at a somewhat higher level, 6, maybe a 7 for today. She records it in her health record, at which time this is written back to her EHR system as a FHIR observation, which can then be used by her care providers and decision support. She wants to also indicate that she has taken her weight. Her weight is now 162. That was recorded into this app from a scale attached to her device, recorded into her health kit. Her weight is now recorded, and with the new health assessments that she has performed, she can then look back at her overview tab. She can refresh this, and that now indicates her updated weight, plus her level 7 of a distress recorded into her record. She also looks at her guide. She can refresh the guide based upon these new activities. The guide has now been updated also to indicate that she now has a weight management warning, that her BMI now indicates she is overweight from new weight. She realizes that she needs to work on that. There's a link for more information. After Meghan reviews the guidance, she wants to contact her care team members. She looks at her care team tab. She can see her primary care provider as well as Vera, her maternity care coordinator. She wants to contact Vera about coordinating some activities, and she has some questions about her OBGYN in the community care. Meghan then returns back to the overall application.
Okay, so getting this into a 3-minute video in 15 minutes is tough, so I talked a bit fast on that video. So what I'd like to leave with is 2 thoughts. First of all, this was described from the person-centric or patient-centric. I think it's extraordinarily valuable to engage the patient as part of the care team. You know, the care plan is not something that the health system does to them. It should not be. It's something where they are an active part. And the FHIR standards allow for activities to be assigned to Meghan, as you saw demonstrated here, or part of the full care team. However, there's also great value in sharing these plans among members of the care team, especially when they're across organizations. In the case of veterans, nearly all of their women's health and pregnancy is outside of the VA. So there's a great deal for situations as complex as Meghan to have active coordination. So in this case, the Apple Care Kit, Health Kit, is specific to one phone and one user. By removing that tab, I've designed this, everything else is native FHIR standards. So when I was refreshing that, it was actually going back to the FHIR server and retrieving observations which had been previously written by the app to the FHIR server. So by removing that tab, the remaining app really is functional for any. So I've got this shown here is Dan. So Dan is another one of the 4 personas. Dan is a Vietnam era vet who also has PTSD and depression. He's 70 years old. He has diabetes and hypertension. Again, these are based upon extensive interviews with veterans and their care providers. So if the same primary care provider supports both Meghan and Dan. This allows then that care provider to review within the mobile app plans across all of her patients, or in case other members of the care team. So it's, I think, a great opportunity to deploy the same application in different environments. And I'll just leave this with a final slide. In January, Connectathon back here in New Orleans, I'm organizing and leading a care plan track. This is the fourth time that I've organized a care plan track at a FHIR Connectathon. And so this time we especially focusing on plan definition to create protocols for patients, create care plans from those protocols, and then some of the prototyping I've shown you here for the plan definition and CQL to define logic around evaluating care plans. And so I'll be actively working on that between now and January, and welcome you all to attend that. Thank you.